Ladies and gentlemen, good morning. Welcome back to your day. Thank you for a good morning back. Welcome back, welcome back. Welcome to your Friday morning. We have a jam-packed morning for you, and I am so excited with what we have on the agenda. It's extraordinary, and if you left here feeling full and inspired, you're going to leave here this afternoon after 12 o'clock feeling even more full and more inspired. So I want to welcome everyone here back for our conference and acknowledge our webcast attendees as well. Thank you for tuning in, and certainly we'd love to hear from you with your tweets as well. So thank you for being here. And to our HRSA staff, to the attendees, to the speakers, welcome back. We're very excited to have you here. Yesterday was a really full day, and as I contemplated what did we experience yesterday, part of my role here is to give you a little recap, just to get those juices flowing again. So as I contemplated the whole day, which it's difficult to summarize it in 5 minutes, but what we experienced yesterday was Dr. Mary Wakefield speaking on building a workforce that reflects the diversity of the patients we serve, about achieving health equity through access to care, a strong workforce, and healthy communities. And that makes sense because we're at Nursing 3D, about workforce diversity, health disparities, and social determinants of health. We're spot on in our content and what we're presenting here. Dr. Sahovsky and Heinrich reinforced the Bureau and Division's commitment to reducing health disparities and improving health equity. And Dr. Shanita Williams told us, we are here to light the torch and carry the flame. So in the Olympic spirit of what we've watched internationally, we're getting some of that here. And she also said on health equity means the highest level of wellness possible for all people. Dr. Beverly Malone inspired us with her phrase, this is about creating and implementing transformative strategies with daring ingenuity. I love that. Daring ingenuity. Are you feeling daring this morning? All right, that's what I want to hear. We're here for daring ingenuity and creativity. As she said, creating and implementing transformative strategies with daring ingenuity. Dr. Paula Braidman told us with health equity can be framed within the context of human rights, and health equity is justice. She got us thinking when she pointed out that genetics loads the gun, but environment pulls the trigger. Profound. Dr. Moy encouraged us to know that when addressing social determinants, we need to target populations for interventions, target communities for interventions, and assess safety nets. I appreciated all of that. Dr. Shobha Srinivasan told us, the I in illness is isolation, and the crucial letters in wellness are we. And we're all part of that, being here today. So moving forward, we need to apply design methods that are relevant to the research question in the community, building partnerships with other disciplines, conduct comprehensive studies that deal with cross-cutting factors. Phenomenal presentation. They were all phenomenal, engaging. There was some laughter and a lot of engagement yesterday. I very much enjoyed it, and it's a phenomenal summit that we're at, right? And we also heard a wealth of wisdom from our panels, not only from the panelists, but also the individuals who posed their questions, the brave souls who wrote their note or stood patiently at the microphones. So yesterday was a very full day, and this morning is going to be a jam-packed morning. And before I introduce our first speaker, Dr. Thomas Leviste, I have the pleasure of announcing, as your MC and host, I should share with you, my name is Dr. Patrick Swift. I'm NYU Langone faculty and affiliated with Diversity Doctor, and happy to be your host. And the poster session winners. Now, yesterday I asked, are you going to go see the posters? So raise your hand if you went to check out the posters. I expect to see everyone's hands up. If your hand isn't up, then raise your hand anyway, because otherwise we're thinking you didn't go. Okay, so we had a great turnout yesterday. I stayed for the whole session. And that was a great turnout. And we are delighted to announce the winners. And the winners are receiving recognition for the hard work they have done. For starters, I want to acknowledge that the posters were phenomenal. Weren't the posters phenomenal when you looked around? They were phenomenal. I mean, the work that folks put into this, presenting the posters themselves, let alone the years of work involved in these programs. I was stunned. As someone in the private sector and working in a medical center, visiting the different posters and speaking with the grantees, speaking with you, I was blown away by the depth and breadth of what was presented there as well. So I want to acknowledge that for everyone, especially in the context of announcing some winners that are getting some acknowledgement. But we all deserve acknowledgement for what we're presenting here. But I will share with you that the third place winner, and I wish we had some drum roll, but I don't think we're going to get drum roll here. But the third place winner, oh my gosh, thank you. I don't know if you can hear that in the webcast, but we're getting drum roll on the tables. So the third place winner is Carmel Belfleur from Nassau Community College. Minority nursing students, strategies for retention. Could you please stand and be recognized, Carmel? Brava, brava. Congratulations, our third place recognition. Our second place recognition is, thank you, drum roll please, Mekian Doyle from Montana State University College of Nursing. It was titled Educator Conscientization Informed by Social Intelligence, a Native Perspective on Teaching Relationships. And you have stood and I missed it. Did you stand? Good. Okay, I was reading. Okay. All right. And last but not least, our first place winner, drum roll please, is Pamela Y. Mahan from Hunter Bellevue School of Nursing, Hunter College of the City University of New York. New York is in the house. Titled Best 2.0, Becoming Excellent Students in Nursing. So congratulations to all our winners, Pamela Mahan, Mekian Doyle, and Carmel Belfleur, and of course to everyone who took the time, invested the energy and effort and heart in the poster presentation. So on that high, pardon? I was getting a signal. Oh, thank you, yes. We'd like to, thank you, Dr. Williams. We'd like to request that the winners of recognition, please, at the first break, go to the salon right next to us where the posters are for a photograph. That's a nice way to be recognized, and also that would be distributed for some more public recognition. So if you're camera shy, I'm sorry, we're going to hunt you down if you don't come anyway. So please make sure you go for the photograph, okay? All right, so moving on with our first speaker. Our first speaker, it is an honor and a privilege to introduce Dr. Thomas LaVeist. Dr. Thomas LaVeist is the William C. and Nancy F. Richardson Professor in Health Policy and Director of the Hopkins Center for Health Disparity Solutions at the Johns Hopkins Bloomberg School of Public Health. He teaches courses in health policy, minority health, cultural competency, and racial disparities in health, to name a few. He is a frequent lecturer at other universities and professional organizations. He has more than 60 articles published in leading scientific journals and has published 4 books. Dr. LaVeist's research has been funded by the National Institutes of Health, the National Center on Minority Health and Health Disparities, the Centers for Disease Control and Prevention, and numerous national foundations. It is my pleasure and honor to introduce Dr. Thomas LaVeist, and if we could give him a HRSA welcome with a standing ovation.